Hello doctors, this is Dr. Peer Naeem. I hope you're all doing well. Today I'm going to explain the process for the doctors who are applying in Oman, especially those doctors who are applying as a specialist or the other category that is consultant level doctors. So the very important point here I would like to mention is if you are a Pakistani postgraduate doctor, I mean if you are having HCPS degree or if you are having MCPS degree, make sure you watch this video completely, and especially at the end of the video I'm going to specify one point that is very much important to know before you start for any process in this category. The first thing I'm going to discuss is about the specialist rank. So for specialist rank, of course, the process for the general physicians and other categories, that is same. Like for example, you have to do your data flow for the important documentations, for example, your degree, your postgraduate degree, your experience, your national country license, for example, the PMDC license. You all need to do the data flow. After doing the data flow, you need to appear in the prometric exam. The prometric exam is the MCQs test. You need to pass that exam before you go into the step 2 process, which is the Viva exam. So very importantly, this video is about what documents you require after you done with your prometric exam, yani step 1, and your data flow is completed already. Then you need to have an offer letter. The employer letter, it means the sponsor who is going to hire you. For example, the any clinic, any hospital, or any healthcare facility must provide you an offer letter. You need to take that offer letter with your CV, with your MD or MBBS certificate, your internship certificate, which is also called house job, your postgraduate degree, means your FCPS or any other postgraduate qualification, and an experience of 3 years after your postgraduate program is compulsory to get a specialist rank after passing your Viva. So make sure you have at least 3 years of experience after your postgraduate program. And then, of course, the data flow and data flow report must be positive. With the prometric test report, means when you will appear in the step 1 prometric exam, they will give you a passing result. You need to attach that result as well, and that result is also make sure that is only valid for 1 year. So if you want to get and secure a position, you need to apply within the 1 year frame, otherwise your prometric step 1 will be expired. The other thing you need is the privileges for surgical and medical procedures. The last thing you require is your passport copy. Now, combining all these documents, you will apply in the Ministry of Health through your sponsor, through the person who is hiring you for his clinic or the person who is hiring you for his hospital. So you can submit all these documents. These documents are mandatory. Without these documents, you cannot secure a job. And after you submit these documents to the Ministry of Health, they will give an appointment for your Viva. And when you will pass your Viva, then you can join your duty place to start your career as a specialist. The dental doctors who having the postgraduate degrees, they also need the same documents. For example, the employer letter, the CV, MD, MBBS certificate, the internship certificate, the postgraduate degree. But in the experience, they need to have at least 20 cases. The cases of orthodontics, they have dealt with the 20 cases minimal, and plus 200 hours implant, they need to submit it with these documents. And when they will submit these documents, they will get an appointment for Viva, and they can appear in Viva. Now here the very important point is, if you are an FCPS doctor, you need to confirm it before starting this process, because right now we have few cases who has been rejected by the Ministry of Health, and they are being refused to give an appointment for the Viva. I'm not sure what is the actual problem, but the most possible reason is they can only work under supervision of consultants. I mean, an FCPS doctor can apply for Oman, but then they will only work in a tertiary care hospital under the supervision of consultants. And why I'm saying this, because if you are not confirming these points and you are applying for the step 1 prometric exam, the data flow, and the other processing, and then at the end if you come to know that you cannot be hired at this position, that will disappoint you, and that will also waste your time and money for doing this process. So make sure you confirm this before you apply for the position of specialist in Oman.